Welcome back to Everyday Kentucky. May is Mental Health Awareness Month, and it's important to discuss the gains made in recent years related to the acceptance of mental health related conversation, while also delving into stigmas that remain.
And joining us now is Dr. Ravi Johar. Good morning to you. Thanks for joining us and talking about such a hard topic to talk to other folks about.
Good morning, guys. It's great to be with you. Yeah, mental health is something that everyone has to deal with. Everyone has mental health, right? And so it's important to make sure that if there's a problem with what's going on with you, that you're able to address it.
Yeah, so why do you think there is such a stigma around mental health?
You're right. There is a stigma, and it's concerning because it forces people to not address their problems and issues. A lot of times people are worried about saying something at work because they may not get that promotion. They may not actually get that job. It can hurt them there. They're worried about saying something to their friends or family because people may treat them differently or they're not sure how to react to them. So I think there's just a lot of concerns that people have out there, and that leads to self-stigma. If someone's suffering from depression or anxiety, they may not want to come forward because they're afraid.
And this affects not not the mental aspect of it. This can affect your whole health as a whole person, right?
Exactly. That's a big thing that's becoming more and more common that people are understanding is the whole person health. That means that anything that your mental health affects your physical health and your physical health affects your mental health. You can't really treat one without treating both. And as people are becoming more and more comfortable with the fact that there is actually an illness, that there is something that needs to be treated, I think people are hopefully becoming more accepting of the fact that they need to get some treatment.
What advice or what are some tips if somebody is struggling, like if you're personally struggling and you don't know how to get help or when you should get help, how should they go about that?
Right, that's an issue sometimes. So one of the easiest ways is honestly to go through your primary care physician. The PCPs know either some mild medication do you need or to get you to a therapist. They can really help you with that. Also, on the back of your insurance card, there's an 800 number. You can always contact that 800 number. At United Healthcare, we put you in touch with a advocate, mental health advocate, who can help screen you and help guide you to the right treatment as soon as possible. A lot of jobs also offer something called an Employee Assistance Program, or EAP. Now, EAPs will usually cover multiple visits, maybe 3 or 4 visits to a mental health care professional, and that's covered through your insurance and through work. So that's another really good way to get into the system.
As a society, are we doing better than early on as far as the stigma around it? We were talking about that a minute ago. Are we doing better as a whole?
Well, I think that as some famous people have started talking about their struggles with mental health issues, people are becoming more aware of it and more cognizant of it. And I think it's becoming less of a stigma, but unfortunately it's still out there. We know that only about 50% of the people that are struggling with a mental health issue will actually seek any kind of treatment. And that's an incredibly low number.
Well, thank you so much for your advice today. I mean, make sure you seek help because mental health is very important. And thanks for being with us, Dr. Ravi.
It's my pleasure. Thank you, guys.